Are weight loss drugs the new way to prevent glaucoma? Weight loss drugs, specifically the GLP-1 receptor agonists, have been getting a lot of buzz in the last few years. This is mainly in regards to treatment for diabetes as well as for obesity. But could they also help prevent glaucoma? Well, just about 3 weeks ago, in February of 2025, a study came out studying the drugs in the context of glaucoma, and the findings here are really interesting. Hi everyone, my name is Dr. Nagori. I'm a board-certified ophthalmologist and a fellowship-trained glaucoma specialist. Today, we're going to dive into GLP-1 drugs and glaucoma and whether they could be potentially helpful in reducing someone's risk of going on to develop this disease. So how do these drugs work? In simple terms, these drugs slow down how quickly food leaves your digestive tract. This helps people to feel fuller for longer, and they also reduce overeating and subsequently help with weight loss. Another mechanism of action is that they also affect the brain to reduce appetite. GLP-1 drugs can act on the brain's appetite centers, and this actually makes people feel less hungry as well. Of course, if you're not as hungry, it means you're going to lower your calorie intake, and this will result in weight loss. Now let's get into this recent study that was published in February of 2025. This study looked at whether people taking GLP-1 receptor agonists for weight loss had a lower risk of developing primary open-angle glaucoma or ocular hypertension when compared to those taking other weight loss medications. The researchers did this by looking at the electronic health records of over 61,000 patients over 20 years from 2004 to the year 2024. The researchers focused the study on non-diabetic patients who had obesity or were overweight, who had taken the GLP-1 drugs or other weight loss drugs. Some of the other weight loss drugs included drugs like orlistat or phentermine topiramate, to name a few. The patients were studied for 3 and 5 years to compare their risk of glaucoma and high eye pressure. So what did the study find? Well, people taking GLP-1 receptor agonists had a much lower risk of developing POAG, which is the abbreviation for primary open-angle glaucoma, or ocular hypertension, which is the scientific term for high eye pressure. But what does lowered risk really mean? And how much lower? So according to the study, the risk of primary open-angle glaucoma dropped by 50.4% at 3 years, and then at 5 years by 58.5%. These are pretty significant findings. Now, what about for ocular hypertension? In ocular hypertension, the patient's eye pressure is high, but there are no signs of glaucomatous damage to the optic nerve. But we do know that having untreated ocular hypertension or having untreated high eye pressure does put patients at risk for developing glaucoma down the line, since high eye pressure is a well-known risk factor for glaucoma. And the number one way we treat patients with glaucoma is by lowering their eye pressure. Now let's get back to the study. So according to the study, ocular hypertension risk dropped by 55.9% at 3 years and 65.8% at 5 years. Again, pretty significant findings. So what does this all mean? So for patients who have obesity or elevated BMI levels, taking a GLP-1, even if you don't have diabetes, could reduce your risk of going on to develop high eye pressure or glaucoma. But it's important to note that there's many patients who are glaucoma suspects or who have ocular hypertension who don't have elevated BMI levels, and they can still go on to develop glaucoma as well. This just proves and reinforces the fact that glaucoma prevention is not just about one thing, and it is a multifactorial disease. Also, genetics plays a strong role, as well as race. And I have another video on the channel about how your race can affect your risk of different eye diseases, which you can check out. But I have many patients who are very healthy weights, but they still go on to develop glaucoma despite optimal weight control and actually having no other chronic illnesses. Some of my patients have no diabetes, no high blood pressure, they are not overweight, and still they do go on to develop glaucoma. So there are other factors at play, but if you are someone who does not have diabetes and you are overweight or you're obese, taking a GLP-1 could potentially reduce your risk of going on to develop glaucoma. Now, of course, in addition to a lowered risk of glaucoma, lowering your weight also impacts your chronic health and can help you control other chronic diseases. For example, we know that sleep apnea is associated with glaucoma, and weight loss can help with sleep apnea as well. So the weight loss can not just help with your chronic diseases, but can also help you treating diseases that are associated with glaucoma. In addition to this, GLP-1 drugs can help your eyes in other ways because they also help with diabetes and high blood pressure, and also can reduce the risk of stroke. And all of these things can have positive downstream effects on the eye. We know that diabetic retinopathy can be reduced with better blood sugar control, and better hypertensive control leads to less strokes, and that means less potential for a stroke-related visual event. So as I tell most of my patients when they ask me what they can do to lower their risk of glaucoma, whatever is good for the rest of your body, meaning whatever is generally good for your heart, your lungs, etc., is usually also pretty good for your eyes. So it does make sense that getting to a healthy weight, if you are obese or overweight, could be helpful in glaucoma risk reduction, even outside of patients who do not have diabetes. Now, of course, more research is going to be needed to better understand how the drugs work in non-diabetic obese patients in the specific context of reducing your risk of glaucoma or high eye pressure. Remember that glaucoma is a treatable condition, so be sure to get screened for it by your ophthalmologist. Hope you found this helpful. Thanks for watching. Remember to hit the like and subscribe button below, and I'll see you in the next video. If you have any questions, be sure to leave them in the comments.